All right. Welcome to the Scrubs to Pivot podcast, where we will explore the endless possibilities within nursing. I am your host, Unique, and I'm here to show you that your nursing degree can take you places you never knew or imagined. So each month, I will interview ambitious nurses who found unique and fulfilling roles away from the bedside. We will discuss everything from remote nursing to entrepreneurship. So whether you're curious about new opportunities or ready for change, you're in the right place. So if you're new here, make sure you join the Scrubs to Pivot nursing community to receive my weekly newsletters and to connect with other ambitious nurses. So the link will be in the show notes. So today I am excited, and I'm excited to have Colleen here. She is a work from home case manager. Colleen will be sharing her journey as a work from home case manager, giving us practical insight into what it looks like working from home as a case manager, offering tips for nurses looking to transition to remote nursing. So, Colleen, welcome to the Scrubs to Pivot podcast.
Thank you. Thank you for having me.
I'm so happy to have you here. So I want you to know that you are my first guest. So if I'm a
Wow.
little bit flustered, that's why.
You're good.
Yay. Okay, so can you just tell us a little bit about yourself, kind of walk us through your nursing journey of where you started into where you are now?
Yeah. For starters, I'm a registered nurse. I have my associate's degree, so I did go to a community college doing a 2-year program. Once I graduated nursing school, I actually started in pre-op, post-op within a hospital. I really loved what I did, working in surgery. I got to see so many different types of surgeries, orthopedic surgeries, some plastic surgeries, kidney related surgeries. So I really liked that. I kind of hopped around different hospitals within the 2 years of me working as a clinical nurse. And so it was just this year that I actually started in a non clinical remote position with a
Okay.
health insurance company.
Okay. Nice. Okay, so how long have you been a nurse?
So yeah, I've been a nurse. In April, it'll be 3 years that I've been a
Oh my
nurse. So I
gosh,
would
this
say,
is
I don't know.
amazing.
I still feel new for sure. But I feel like I've also seen a lot and learned a lot too. So yeah, it's a very interesting spot to be in.
Okay. So
Yeah.
you went from
Yeah,
pre-op,
so
post-op to
to
remote case
remote, and
manager.
I went remote like February. So I went remote February of this year. So I went remote really a little bit before my 2 years as a nurse.
Oh my gosh, wow.
Yeah, just a
So
few
you have
months.
like a unicorn story because not many nurses, I know so many nurses, especially fairly new nurses, they would like to transition to remote nursing and they find it very difficult.
Yeah. Because on my team, I work on a team of nurses, and I would say that I'm, the youngest. Everyone's been a nurse for, I don't even know, 10 plus years, some 20 plus years. So I definitely am the newest nurse in my group of nurses, but I still really enjoy it. They still respect me. I still bring value to the table. So yeah, I like what I do, and it's so that's why it's just such a really interesting place to be because this is at this point of my career, I still have so many years ahead of me. So it's almost like
Right.
I can build my career in this area. Yeah.
Right. So, what attracted you to your current position?
So surprisingly, I found my current position on Indeed. I had filled out that application through Indeed, but then I also went back and filled out the application like on the company's website.
Mm-hmm.
Um, and the reason, and then they were also holding a job fair.
Oh, wow.
So I made it a priority to make sure to go to that job fair. And there I was able to do essentially like an on the spot interview. Um,
Wow.
Yeah, and then maybe, I don't even know, a few weeks later is when they did they asked me for a second interview. We did that, and then maybe you know, a couple of weeks or a month after that, then they finally made an offer. So
Wow.
yeah, yeah. And what was crazy was for the job that I was working, I was still working as a pre-op nurse. I enjoyed the job that I did, but we were having a lot of changes at the hospital that I worked at. So I just felt like, okay, well, this is my time to see what other options, there are for me. It was so crazy because I still wanted to stay. I still wanted to work in the hospital. Um, I was even considering turning down the job that I have now. But I just realized that this is an opportunity. It's something different. You
Right.
know, the hospital's always going to be there. Hospital's always going to be
That's for sure.
there. So yeah, so I took it and ran with it. So yeah.
Nice, nice. So, did you have any hesitation with, I guess, taking the position, like in regards to
I
like
think
your
my
nursing
hesitation was
skills?
just because I am a case manager for a health insurance company. It is a telephonic position, so a lot of the things that I heard about telephonic case management was just that you have unrealistic caseloads. You're tied to the phone. You um you're going to be working all hours. You're going to get you know phone calls from whoever, family, doctors, providers, whatever the case is.
Mm-hmm.
Honestly, I mean, I haven't really had that experience. I feel like it's been pretty manageable for me. I don't feel tied to the phone
Wow.
at all. I don't, it's just kind of one of those things where it's just like, what I was told and what I experienced are two different things.
Yeah.
So, yeah.
Yeah. Like your story is like the exact opposite of what I hear
Yeah,
and what I
yeah.
read on the different groups
Yeah,
and
and I think
stuff.
and I think also, and that's what made me realize that you kind of have to take what other nurses say with a grain of salt, because I feel, just from talking to other nurses, I feel like a lot of nurses went remote because they were burnt out, they were tired of the bedside, whatever the case is. But that was not my story. I was not burnt out. I love, working with the people that I work with. I love working in surgery. I never felt burnt out ever working in surgery. So that wasn't my story. So it would
Mm-hmm.
make sense how it would make sense that they say the things that they do, because it's like you're saying it, I don't know, out of desperation, or out of, okay, well, I was just trying to get out of that situation. Now I'm in another situation that I don't really like, versus being like,
Right,
well, this is more
right.
thought out, something that I carefully considered. I weighed my options, you know, I don't know. That's just kind of how I view it.
Yeah, yeah, I get that because that's definitely something that I feel like I've kind of stressed in my TikTok videos and stuff. Is
Mhm.
like you can't just jump from one thing to the next thing. You got to
Yeah,
have a plan. It's got to be calculated.
yeah. And then there are a lot of nurses that, and I don't know where this comes from. There are a lot of nurses that almost feel like, okay, well, I need to go remote so that I can take care of my kids and I can do laundry and I can do my errands and and I'm just like, is it not still a job? What?
Right,
It's a
right.
job. It's still,
You
so I
cannot
don't.
do all of those
Yeah,
things.
or just like, I want to go remote because I want to be more with my family, which is fair, but
Mm-hmm.
it's still, that's how you kind of get the unrealistic expectation of the remote position, or that's when you start to get those, well, I just hated it. It just wasn't for me. And then also, I
Right,
mean, and
right.
then also there's another factor of, with me only being at almost 3 years, I feel comfortable moving around, whereas it would be harder for a nurse who has been at the bedside for 10, 15, 20 years
Mm-hmm.
to make that transition, because working remote essentially is like starting a new career, even though it is healthcare related or whatever. It's, a new career. You're learning corporate speak, whatever the case is. And you kind of have to, I don't know, prepare yourself for that. Whereas I know that
Mm-hmm.
that may be harder for like a more seasoned nurse, or even just a nurse that
Right,
has
right.
never considered something non clinical or away from the bedside.
Yeah, that's a very good point.
Yeah.
The more seasoned you are, you may have a more difficult time making the transition.
Yeah. Versus whereas me, I mean, I had, I switched hospitals within the first year of being a nurse. I've taken on PRN positions. I feel
Mm,
comfortable moving around. I don't feel loyal to a hospital. I don't feel
right.
tied or obligated. I truly feel like, nursing in your career should be flexible. You should be able to try new things, whatever your interests are. But I feel like for nurses, I don't know, sometimes that's not always conveyed, especially through nursing school. You're taught graduate, get a bedside job, maybe go back to school to become a nurse practitioner or to work as, in administration and then eventually
Right.
retire. And that's it. That's not, I don't know, nursing is so vast and you have such a long career, especially depending on what time you get into nursing. It's in your best interest to try different things.
Yeah, yeah. And I love that. I love that because I've definitely jumped around in my career. I've never really stayed at one
Mhm.
place. So,
And listen, in every place you learn something, and
mm-hmm.
it brings you to the next job, and you can bring that to the next job. And
Yeah.
even with me, I worked in registrars, like I guess admissions. I don't know what you would want to call it, but before I was a nurse, I worked in so managing, like running insurance,
Oh, okay.
collecting copays at an emergency room. I did that for about a year, and then I went to nursing school. But I felt like the knowledge and information that I got from that job, so a non-clinical, non-nursing job, is serving me now as a nurse
Yes.
because I'm able to understand how, insurance works, how copays work, what a premium is. I'm have, I would say, a little bit more of a baseline understanding of health insurance compared to the average nurse because I did have that experience prior to becoming a nurse. And like I said, that experience still is serving me to this day.
Yeah. Yeah.
Yeah.
I love that. And it just builds like all the skills you learn, it just builds on each other.
Yeah, and I don't want anyone to ever feel like what they learn on a job is ever wasted. Um,
Mm-hmm.
I think that's why it's really important to be intentional with where you work or which specialty you choose, or just,
Right.
be intentional about investing in your interests and in your hobbies because that is what builds your career. That's what builds your lifestyle. That's what builds your personality, your identity, your character. So yeah.
Yes, I love it. I love it. So, how long would you say it took you to land your position, like from the time you interviewed to you accepted the role?
Yeah, so okay, I'm trying to think. From the time I interviewed to like, are you saying doing the offer letter, starting the offer
Mm-hmm.
or accepting the offer letter?
Yeah.
Um, I would say maybe 3 months, maybe three
Okay.
months. Yeah,
Okay. Okay.
yeah,
I think that's about the average time, about three
yeah.
months.
Because I did the interview essentially in person at the job fair, and then I believe it was like 2 to 3 weeks later was when they said, hey, we decided that you'd be a good candidate for this position. Will you complete another round of interviews? And so I did. And then I think, yeah, about a month or 2, 3 weeks after that, that's when they made me an offer.
Oh, okay. Okay.
Yeah.
All right. And did you face any challenges with transitioning to remote work?
Challenges, I'm trying to think. Can you give me an example of like, you know, what challenges that?
Maybe like I know for some people, like just setting the boundaries, like with your family, not having
Yeah.
interruptions.
Yeah, for sure. Um, Yeah, I think me and my husband are going through that now because he'll just walk in my office and I'm like, I'm on the phone. I'm like, you do know I have to work, or just like, I don't know. Sometimes he like thinks yes, I am at home all day, but I am working. So sometimes he's like, well, why isn't this done? Or you could do this. And I'm like, I'm working. Like,
Working.
yeah.
Yeah.
I'm like,
OMG.
yeah. So that's just kind of been it. Just kind of working on that. But other than that, I mean, not really. Not anything. I don't think I've experienced anything super challenging.
Did you have any issues as far as like navigating the different systems, the screens?
Um, I would say not really, because with my position, they gave us about 3 months of training before we officially started taking a caseload of members. Um, so during those 3 months, I, was getting used to that, getting familiar with working from home. It did. The only thing I would say that it definitely was challenging learning like what they are needing, like as far as like charting and what information to include, because in the hospital, we're used to clicking boxes or entering vital signs, entering little assessment notes. But it's different whenever it's okay, you just had a 30-minute conversation. Now you need to write
Oh,
something
right.
about it or
Right.
whatever the case is. And then so it's like, okay, well, what do I include? Or do I just say
Right.
do I write every single little thing that we talked about? So that was kind of different. But it's since got better, and my job, they're really good about doing little in services, things like that. If we have questions, we can always ask as far as navigating the charting system and things like that.
Okay. Okay. All right. That's good. And can you give us a walkthrough of what a typical day looks like for you?
Yeah, so a typical day, I usually log on. I don't know. I think I would say the first thing I do is maybe check my email or check Teams. Usually, my group, they just, everyone says good morning. But I usually check my email. I also try to look at my calendar to see if I have any meetings that day, and then kind of just make a mental note of that. And then I kind of just jump right into my caseload. So this can be, and like I said, talking about being a telephonic case manager, I mean, we still have to kind of like plan our day. So it may be, okay, I need to make a phone call, but then I'm, so we just have like a work list of items that we create for ourselves. And sometimes our supervisor or other departments can send us like a work list item. It could be, okay, call this person, but then the next item could be, okay, email this person. Okay, chart on this. So it's not always just back to back phone calls. And you also,
Okay.
like me as a case manager, I'm responsible for kind of organizing my day. So,
Right.
I know not every, case manager position is like that, but that's just how it is for me.
Okay.
Yeah.
And would
And
you say what is a typical like workload or
like number of,
number of
yeah.
patients? Yeah.
Yeah. Right now I think I'm about at maybe 80 or so.
Okay.
And the way it works for us is we're just required to do at least one monthly outreach. I mean, of course, you could do more, but we're just required to do one a month.
Okay. And are you mostly making outbound calls or are you receiving inbound calls
Yeah,
as well?
sometimes so I always tell, so I have my own work phone, and I always tell my members, I'm like, save my number. You can call me if you have questions on anything. So, sometimes I can call them, they won't answer, and they'll call me back maybe a couple hours later or whatever. So yeah, but I would say the majority of my calls is outbound. So yeah.
Okay. Okay. And your day varies from day to day, sounds like.
Yeah, yeah. Because each individual, so for the caseload, we're just each individual member or client or patient, whatever you want to call them. We are all working on different things. The type of population that I work with is complex. So those that
Okay.
have multiple comorbidities, but then also have social determinant of health factors that are also affecting their health. So we just kind of work together. I kind of just help them create goals, and each time that I'm calling them, I'm making sure that we're working towards those goals. Um, yeah, I mean, I enjoy what I do. It's a lot of education.
Mm-hmm.
Um, yeah, I'm helping people make healthier choices, but also helping them navigate the healthcare system because there is a lot of misinformation on how the healthcare system works.
Yeah.
Um, so definitely just helping them ultimately just receive the care that they need, but then also truly helping them feel empowered as they interact with the healthcare system, feel empowered to talk to their doctors if they have a question, feel empowered to schedule their own appointments, feel empowered to change a provider if they feel like they're not getting adequate care.
Yeah.
Empowering them to challenge things, whether they get a bill in the mail that they have questions about, just helping them make a more informed decision.
Informed decision. Yeah. See,
Mm.
I like that we're having this conversation because I've just seen online like horror stories about telephonic case manager
Yeah,
positions, and
yeah,
I've seen some people say that they feel like they're just like salespeople, just
yeah. I've heard people say that
calling.
too. No, I
And
mean,
what you're saying is like the opposite.
yeah, no, I mean, and I think her name is Katie. I think her on TikTok. I think her handle is the bullish nurse. She is like
Mm,
I believe like she's a nurse, and she also hires for a lot of remote positions, a lot of clinical, like nursing or healthcare related remote positions. And that's something that I've heard her say a lot in her TikToks is like, we can't just jump to a remote position. There are so many different types of remote nursing positions or positions that hire nurses. You have to
right.
find what aligns with you, because to it's hard to be a nurse that says that you don't like case management or whatever the case is, but haven't tried other areas or even considered other areas, because it isn't for every nurse. But for me,
Right.
I feel like I've always had kind of like a public health interest.
Mm-hmm.
Um, so that's why I enjoy what I do. I enjoy, helping people find the nearest food bank. Like that's not, I enjoy being knowledgeable about different community resources. But some nurses aren't like that. Some nurses really love the science behind nursing. Some nurses really love,
Right.
you know, the administration part, the provider part, and that's fine. But there's a different role for that.
Yeah.
Yeah,
Yeah.
it's kind of how I feel about it.
Yeah, and it's definitely important for nurses who want to transition to remote work to do your research.
Yeah, and yeah, do
It's
your
so
research,
important.
find a fit. Because sometimes people just see remote and then that's it. But you have to also
Mm-hmm.
understand that, do these tasks and duties align with you?
Yeah.
Do they align with your values? Do they align with, does this population that you're serving, is that the population that you want to serve? You know what I'm saying? Are you okay with serving people that, you know, um, have financial issues, or even have, a criminal background, or whatever the case is? Or do you just prefer women's health, or do you just prefer children, or, whatever that thing is? Make sure that
Right.
that's also included or at the forefront when you're accepting these positions.
Yeah. Yeah. I think that is so important. So, would you, can you give us some pros and cons of working remotely or working as case manager?
Okay, pros and cons. Pros is really just really being able to have that autonomy as a person, but also as a nurse, because it's so crazy. And I say this all the time, ever since working remote, I feel like I am more me. Like I feel like I'm the most like version of myself. Like I feel like I have permission to be myself.
Oh, that's awesome.
Whereas working in the hospital or in person, I would, be very cognizant about how I did my hair or what just even what I said or
Right.
things like that. Whereas now I feel like I can just kind of, I don't know, just do whatever and
Really be
not,
yourself.
no one cares, no one knows. I get to try out different things, try out different
Mm-hmm.
styles and just be more me. Um, so that's something that is a really big pro that I have enjoyed. And another pro is just being able to structure my day. Um, I am thankful that I can be able to be like, okay, on my hour lunch break, I want to go to the gym or I want to go to the store or
Yeah,
whatever, or I
yeah.
want to take another 10, 20-minute break to go run a quick errand or whatever the case is, and um, be okay to do those things. Um, so yeah, just kind of adding more value to my day. Is
Mm-hmm.
something that has been a big pro. And then for the cons, I would just say, I mean, it can definitely get lonely. I would
Yes.
say, yeah, 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 it definitely can. So that's what I'm saying. You have to be very mindful to kind of prevent that.
Mm-hmm.
So that's why I make it a point to like on the weekends or after work, I will call a friend or, plan something. It's very easy to fall into a rut of just like, wearing sweats all day or
Mm-hmm.
just being in the house or just realizing like, dang, I went the whole day and I didn't really like interact that much with
Yeah,
people.
yeah.
So just being more mindful of that. And then, I guess just a con would just be, you just miss that bond that you get with coworkers and being, in person. I know like especially with the holidays that just passed, I loved like doing like dressing up with my coworkers around the holidays and stuff like that.
Yeah.
So yeah, so you kind of miss that, but I try to like make up for it by like buying little like festive things for my desk or joining different like we have different like groups at my through my company, so like they have like book
Okay.
clubs and things like that, so I try to join those. And then even just just interacting with my coworkers, calling them on Teams, talking for a little bit, things like that.
Yeah, yeah. So it sounds like you in a way kind of have better work-life balance because
Yes,
you
100%,
are able to
100%.
prioritize things that mean, what am I saying,
Yeah,
you're able to prioritize going to the gym and
yeah, for sure.
um have all more autonomy with your
Mhm.
day.
Yeah, I feel more present now than ever,
Hmm.
you know, because, yeah, I get to just, yeah, just fully immerse myself. I don't have to just worry so much about, okay, I got to get to work. I got to get to work by this time.
Yeah,
And then
yeah.
I got to make sure my scrubs are looking good. And then, okay, there's that one coworker that I don't really like, but I have to talk to them. And then, that one doctor that is always so rude and I always have to like no, like it's none of that. It's just me, my caseload of my patients, and then my coworkers there to help, and then that's just it.
Yeah, yeah. And I mean, working from home is like what you make of it,
Mm-hmm. Yeah, it
because
really is.
I wouldn't say that there really is any cons, like it's just things that you have to be mindful of, like
Yeah,
getting dressed, going outside,
yeah,
maintaining social
yeah, for sure.
interactions.
Yeah, for sure, and especially just now with it getting dark, like it's like I think I had like maybe 10, 20 minutes of sunlight by the time I get off. So just, yeah, just making sure that, on my break that I am going out, doing different things, watering my plants, whatever the case is. Yeah. But again, that adds to being able to be more present.
Right, right. Oh, did we freeze?
Yeah. Basically what I was just saying is that being kind of more isolated does kind of force me to be more mindful and forces me to
Mm-hmm.
prioritize friendships, relationships, socializing. So I think that's, if anything, a
Yes.
plus because I didn't really get to do that as much working in the hospital.
Okay. Okay. And do you ever plan to go back to traditional nursing, or you think this is where you're at in this life?
Yes, not looking too good. It's just, yeah, I mean, it just really truly comes down to, yeah, it's like with this position, I make more money than what I did in the hospital. I mean, I'm non-clinical, so
Yeah.
I mean, it is what it is. Also, I personally feel like my position allows for me to have more room to grow. So just even
Yeah.
within
Yeah.
the company itself is so huge that just finding something, staying put and finding something within the company is already so many opportunities. Versus in the hospital, I kind of felt like
Mm-hmm.
I did not have room to grow because
Yeah. Yeah. I would say it's probably less
because I
opportunities.
mean I I worked in pre-op, which I enjoyed, but I mean, where do you go from? Where do you go from there? Do you just work in the OR, pack you? Maybe one day become a manager. I don't know. And that's
Yeah.
not.
Yeah.
Yeah, that's not really um, growth to me. Um, Whereas my current job, I feel like I can network more with people. Like even now, I signed up for a mentorship program that they have within my company, and I was assigned a mentor, and we're gonna set
That's
up time
great.
to talk more and things like that. Whereas in the hospital, that was not offered at all. Nothing close to that was offered in the hospital. So just being able to be a part of just different things, just yeah, interacting, networking, learning. Another thing too is I'm also a part of the DEI council at my current company, which that's something that was never offered in the hospital. um,
Oh,
so yeah,
nice.
just broadening my horizon, getting to just try different things. That's something that's what's
Yeah.
really important to me. um, so yeah, it just doesn't make sense to go back. But never say never.
Yeah.
You never know.
Yeah. Yeah, it's always
Yeah.
there.
So yeah, that's just kind of how I feel about it.
Okay. So, what advice can you share with nurses who are considering remote work?
Yeah, I would just definitely say that there's definitely so many positions out there. Don't feel like you need to always search remote nurse. There's so many different
Yeah.
positions that hire nurses. We have a wealth of knowledge of as nurses. We just need to apply it. Yeah, the opportunities are out there. You just have to be willing to be okay with that learning curve that comes with going remote. But once you're okay with
hmm
that, then I mean the sky's the limit. You open yourself to a whole new side of your career, and a whole new side of healthcare that you didn't know was there.
Yeah. Yeah. That's the amazing thing is that there's just a whole
It
nother
really,
world.
it really is, and it's a shame that I don't know nurses feel like we're not like we shouldn't be included in that conversation when really we are like the experts. So yeah, that's why I feel like nurses shouldn't be afraid to think outside the box, look at positions that aren't only have nurse in the title, to be okay with doing something that's
Right.
different from um, what we thought nurses could do, what we were taught that nurses could do. So yeah, yeah, you'd be surprised at how many positions hire nurses, but nurses aren't the only candidates that they're looking at.
Right. Right. And that's why I started this podcast, just to kind of bring light and awareness to all of what is
Yeah.
possible.
Yeah. And I think nurses should also be, I think sometimes for nurses, it's so funny. Sometimes I feel like it's hard for us to change, or we want to change, but then not really, or wwhatever. So sometimes it's like a give and take.
Yeah.
So you can't want to go remote, but then I don't know, but still want to be in the, still want to be in the hospital, still want your 312s. It is possible, but it's just like a give and take situation. Like you just kind of have to be willing to kind of work with the system and figure out, where you fit in there.
Yeah. Yeah.
Yeah.
So, are you open? So, when I first came across like one of your TikTok videos, I noticed that you said like you wanted to help people, help nurses, like whether they want to get into remote work or, just help nurses like kind of find their
Yeah.
way. And so I was like, I knew from that point, I was like, maybe we can like
Yeah.
collaborate in some type of way. But where can nurses find you? Where can they connect with you?
Yeah. Okay, so on TikTok, my TikTok handle is COLLEIA. I just talk about nursing stuff, remote stuff, but also like girly stuff or whatever. And then I do have an Instagram. I don't really talk much about nursing on there, but if you want to follow me just to see,
Yeah.
if people want to follow me just to see what I be up to, my Instagram is creating_Colleen. And I'm trying to think.
Okay.
Yeah, those are kind of the main two places that I'm at. But yeah.
Okay. And I will put your handles like in the
Hmm.
show notes so people can follow you. I know with like TikTok being up in the
Yeah.
air, like we're having to pivot.
Right.
So yeah,
I know. I
all
keep seeing
that.
lemonade. I'm like, I don't know what that is, but maybe I have to make it.
Yeah, I did make an account, but I wasn't
Yeah.
really
I was like,
feeling
I
it.
don't know what this is
So
about. But maybe.
yeah.
But yeah, for now, I'm on
Yeah.
TikTok and Instagram.
Okay, so I will put your information there. People can reach out to you if they have additional questions. I thank you so
Yay.
much for doing this interview with me. I feel like it was very insightful
Yeah.
and I
I
enjoyed
enjoyed it too. I love talking
it.
about stuff like this, and I'm glad that you have taken the time to make a platform and a space for this. So yeah.
Okay, so I wish you a happy new year. Here, I'm going to
Yeah,
stop the
we can chit chat.
recording.